Go.
Hi, good evening. My name is Stasar Garcia. This evening I'm going to give you an informed speech on the insertion of an NPA. Basic airway management in adults is most often needed because of inadequate ventilation, which can result from impaired respiratory or airway obstruction. Basic airway interventions may also be needed to manage the patient with inadequate oxygenation. That's from Tobias Barker, MD, from an up-to-date website. Also, what we're going to be discussing is some indications for an NPA, some contraindications, and why you would want to use it. Basically, we have Private Parker here who has volunteered to go ahead and be my demonstrator for the NPA. Okay. The first thing we have to do is find out, give us a need for an NPA. An NPA is a nasopharyngeal airway. What it does is it provides an access for an airway on patients who are somehow compromised airway on battlefield. What we're going to do now is we're going to go over some indications for it. Okay. One of your big things is your need for an airway is because for some reason his airway is compromised, be it his roof of the mouth or the tongue has relaxed and occluded the airway, or some type of trauma has occurred. One of your things you want to do is necessitate the need. Okay. If he's breathing, what you're going to do is you're going to open up the airway using a head tilt chin lift method. What this does is provides an airway opening for the air to go in through the nose and mouth into the lungs. Sometimes, even open up the airway, you don't provide enough oxygen for the patient to breathe. Okay, so this time we go ahead and look, listen, and feel. We see a rise and fall of the chest. We count the rise and fall of the chest for about 15 seconds. We multiply that times 4 and give us a per minute rate. If the cavity is breathing about 8 or less, we're going to go ahead and assume that he has an inadequate airway. At this time, we would go ahead and give him an airway. Also, another need for it would be if you hear a snoring sound or a gurgling sound in the airway itself. And that can be also assessed as you look, listen, and feel. Some contraindications would be the nose is obviously malformed, meaning it has a dislocation. The nose is broken. You have some fluid leaking out of the ears or nose, or even in the mouth. As you do your head tilt chin lift, you should be opening up the airway to assess the roof of the mouth. It should be a nice dome shape on top. If you see it kind of protruding down, or if you see any brain matter in the airway, you don't want to go ahead and do this because it can actually insert it into the brain cavity. Some other things we're looking at is the patency of the airway, of the nose itself. Patency means that it's clear all the way through. So as you look in, you can just look real quick, you open up the airway and you assess it. So you're looking at the roof of the mouth, inside the nose, inside the ears. If you see any fluids in any of those areas, you don't want to go ahead and put the NPA. They come in different sizes. Normally it's going to be about 9 millimeters. This one right here is 9.4 millimeters. Okay, and if you look in the front of the package, it'll tell you what size. To size it, what we're going to do is we're going to look at the little finger on the cavity. It should be either that size or smaller. Okay, if we look here, we can see that this is smaller than his nose, or it's smaller than his pinky, so it should fit into his nose. All right. First thing we're going to do, like I said, we're going to get a need for an airway. He's breathing right now. We're going to assume he's breathing at 8 or less. So that gives us our indication that he has an inadequate airway. First thing we want to do is size it up. And we size it up to his pinky. Next thing we want to do is size it up to the patient itself. From the tip of the earlobe to the tip of the nose. What that does is give us our airway, because it actually goes from the front all the way back into the back of the throat. So that gives us our length. Next thing we want to do is go ahead and lube it up. The more lube you have, the easier it actually goes in. All right, so we get to this surgical lube and make it all nice and goopy. All right, next we're going to insert it. You want to go into the right nostril if possible, okay? The reason for that is because the right nostril is anatomically positioned where it goes all the way through into his oropharynx. At this time, we put the bevel, which is this little cut side, pointed towards the middle of the nose. And we look on him, it's his right side, not yours, okay? So you look at the right side, which is this side, which is closest to me. You pull up the nostril, insert it, bevel towards the septum, and push it in. It should go in and slides in, slides in, slides in. Breathe, swallow, 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 swallow. Breathe, breathe, breathe. Breathe, breathe, swallow, swallow. Did it hurt? Okay. All right. We're going to assume it goes all the way. What you want to actually do is you want to insert it all the way. I'm not going to force it into his nose. What you would actually do is put it in so it goes all the way to the base of this flange right here and rest all the way. Since right now it doesn't go in, I would actually take it out and try on the other side, okay? But we're causing him a little bit of pain, so I'm not going to go ahead and do that, okay? Now, in actual real-world casualty, the pain is secondary, okay? We need to get that airway open. So you would actually go ahead and do it on the other side. But since he's like with us and he's got some tears in his eyes, we're not going to go ahead and do that, okay? Again, the reason for this is because we have an airway compromise and we need to get this airway in, okay? And like I said, in an actual casualty, this does go in quick, and I wouldn't care about if it's hurting or not, okay? It's got to go in, we got to put it in. Okay, does anybody have any questions over anything we've discussed today? Actually, take that back. What we discussed today is the need for an airway and the interventions we can use. We talked about some indications and some contraindications of why we would put the NPA in, and it kind of helps that we have a live casualty to do this on. Additionally, we have other means of opening the airway and some more advanced airway management. We can actually, if he was really compromised, we can actually cut his throat open a little and put a tube inside his throat to give him an advanced airway. And that's a little bit higher up. All right, this time, go ahead and take it out. And breathe. And that concludes my speech. Thank you very much. And apologize.